Hello there. Today we will be presenting about communication barriers faced by medical students at hospital. This project is brought to you by myself, Sayed Abidi, and my teammates Ahmed Mahfouz and Hamza Gori. We will first look at an example of a medical history taken between a doctor and patient that speak the same language, in this case English.
Hello there. Good morning. How are you? So my name is Sayed. I'm a medical student and I'm working with Dr. Michael Al, and I will be taking your medical history today. So before we begin, can I get your name and age, please?
I'm close 22 years of age.
Okay, so Mr. Ahmed, that's perfect. What brings you to the hospital today?
Just had a little bit of chest pain, cold on my chest.
Okay, so you have chest pain. All right, and could you tell me when this pain started?
About 2 to 3 weeks ago.
2 weeks ago, 2 to 3 weeks. All right. And could you tell me where exactly does it hurt on the chest? Like, could you point it out to me?
The midpoint of my chest, right?
Okay, so somewhere in the middle of the chest. All right. And could you tell me that does the pain from your chest, does it radiate to any other part of your body, or
It radiates down my left arm.
radiates down your left arm? All right. And could you describe the pain to me?
It's like a rod sitting on my chest.
Okay, so you feel like a heavy weight on your
Impact
chest.
it.
All right. Okay, that is all right. So, Mr. Mahfouz, we will perform some further tests on you, and I will go ahead and order a lab troponin test and a stress test for you, and we will move on ahead from there. There's nothing to worry about at the moment. You're in very good hands today, and it should all be fine. So I'll just go ahead and get someone for you, and it should all be good. All right?
Thanks so much, Mr.
No
Sayed.
problem.
Let's now take a look at a medical history taken between a doctor and patient where the patient can only speak in Urdu while the doctor can only communicate in English, leading to a barrier in intercultural communication.
Hello there, my name is Sayed. Walaikum salam. So my name is Sayed, I'm a medical student and I'm working with Dr. Michael Al. And I will be taking your medical history today. So before we begin, can I please get your name and age? Your name?
Naam Hamza.
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 Okay, and what is your age, sir?
Understand? No understand.
Age? How big? Age?
23.
23 years old. All right, Hamza, and you're 23 years old. All right. So Hamza, what brings you to the hospital today? Why are you?
दर्द हो रहा है सीने में दर्द हो रहा है.
Why you? Is there any problem? What is the problem?
Problem
Pain.
here problem.
Pain?
Yeah.
Okay. You have pain in the chest. All right. So Hamza, chest pain. All right, Hamza. So when did this pain start? When? How much time? Pain? How much?
मुझे नहीं समझ आ रहा.
How much? Okay, no problem. So Hamza, could you tell me what languages you speak? So maybe I could get someone who can speak to you. You don't speak English?
No, English no.
do you
Little English, little.
Do you speak Arabic?
No Arabic.
Do you speak Hindi?
No Arabic, no Hindi.
Do you speak Urdu?
Yes.
Okay.
Oh, Hindi.
Urdu.
Hindi and Urdu.
Urdu.
बोलो.
Okay. So you know what? This is what I'll do for you. I'll find someone who can speak Urdu, and they can talk to you about what the problem is. And okay, so I'll go get someone. All right, Hamza. You just sit tight. All right. Bye bye.
Based on the videos we have seen so far, it is evident that language barriers is a big issue in Qatar. This is especially true due to the heavy prevalence of foreign nationals present in Qatar that do not speak in English, and many of the patients that come to hospitals in Qatar do not speak Arabic as well. As such, we will be following Weill Cornell medicine students and interviewing them and learning about their experiences doing hospital clerkships in Qatar and learning about how the difference in the primary language of communication affects the doctor-patient communication and to what extent. The research questions explored in this project are the difficulties that Cornell students face when working in a hospital as part of a clerkship, the barriers to effective intercultural communications the students of Cornell face when communicating with patients. Do these barriers cause a hindrance in their learning experience? And finally, do patients reveal more information about their health statuses when communicating to doctors from the same culture and linguistic background as themselves? The data for this project was collected by highlighting the three primary languages that are used in Qatar, which are Arabic, English, and Hindi or Urdu. And of these three different languages, three different groups of students from Will Cornell Medicine were selected. The first group was students that spoke Arabic and English and had experience seeing patients who could not speak those languages and only spoke Hindi or Urdu. The second group were patients who, or medical students who spoke in English and Hindi or Urdu, but had to see patients that could not speak either of these languages and could only speak Arabic. And finally, we looked at students that could only speak in English but had to interact with patients that could only speak in Hindi or Urdu or in Arabic and not in English. The students interviewed as part of this project were asked the following questions. The question started by asking them where they came from and the languages they spoke, followed by asking various questions about their interactions with patients, especially patients with whom they had difficulty communicating to due to the presence of language barriers, and finally asking them for their reflections on how communicating with patients with linguistic barriers took away from the patient's hospital experience as well as their own experiences and their own learning opportunities. For the interview pool, we had 4 students that were selected to be interviewed based on the 3 different groups of students that we had highlighted earlier based on the spoken languages. One of these students spoke in Arabic and English, one of the students spoke only in English, while 2 students could speak both English and Urdu. Upon interviewing the students that spoke in Urdu, we found that they were able to communicate with patients, especially in the emergency rooms where a majority of the patients that come into Hamad are patients that can speak only in Hindi or Urdu, being blue collar workers. About 50% of Qatar's population is South Asian, and which includes countries such as India, Pakistan, Bangladesh, Nepal, and Sri Lanka, and can speak Hindi or Urdu to some extent, while only 11% of Qatar's population speaks in Arabic. These students also mentioned how they felt difficulty in creating workplace bonds due to doctors largely speaking Arabic. The Arabic speaking medical student that was interviewed as part of this project also expressed that they felt confident when communicating with patients, especially when working in specialty clinics and health centers where a majority of the patients spoke in Arabic, while they had little difficulty when communicating with patients, especially in the emergency department and the diabetic clinic, where majority of the patients only spoke in Hindi or Urdu. In these cases, they resorted to the use of nonverbal communication as well as the use of broken English, which is a very simplified version of English that uses common words. The medical student that was interviewed that could only speak in English and not speak Hindi, Urdu, or Arabic felt that they were severely disadvantaged in their ability to communicate with patients in Qatar because a lot of the patients that they saw in the hospitals were patients that could only speak uh, a different language and could not communicate effectively in English. Uh, the medical student mentioned that in many of the cases they would have to rely on speaking in broken English or using a third party such as immediate family members accompanying the patients or other doctors or nurses that are present. They would have to rely on such individuals to help in translations. Across the board, it was found that globally in many hospitals around the world, especially in New York, where many of these students have completed their internships, as well as the Hamad Medical Corporation, translation services exist that can be used by medical students. However, these translation services are largely inadequate in Qatar, and instead, the hotline operator advises the students to go and seek someone who can actually speak the languages that they are seeking help in. Additionally, the students also mention how they struggled in translating English medical terminology to Arabic, even when they could speak the language, as some of these terminologies do not directly translate in Arabic. The infographic on this screen shows 6 steps that occur when a patient-doctor interaction breaks down due to communication barrier. The first step of the process is the initiation of the conversation. After that, the doctor realizes, in this case, the medical student realizes the existence of a language barrier. Upon finding such a thing, the doctors start using nonverbal communication to try and gather as much information as possible. And then once they realize that more information cannot be gathered, at this point they are forced to give up and seek help from third parties, such as family members of the patients accompanying them or other doctors and nurses. And through the help of these intermediaries, they are able to further gather information. The interviewed students, especially the ones speaking in primarily Hindi and Urdu as well as in English, felt that their learning ability was heavily hindered when they were unable to communicate with patients, as well as when they were uh, not included in the workplace with the Arabic-speaking doctors. As a result, some of these students expressed feelings of doubt in practicing medicine in Qatar after graduation. Um, they also felt that the patient experience is heavily hindered due to these barriers in intercultural communication, as well as the ability of doctors to gain relevant information from patients. To conclude the findings of this project, we found that language barriers are a big issue in hospital settings in Qatar, and the existence of such has a strong negative impact on both the patient experience as well as the student learning opportunities. Mitigation strategies such as translation services are present in hospitals in Qatar, but these cannot be adequately relied upon by both the students and the medical staff at hospitals. We also found that Cornell employs the use of English in its education, and the medical terminologies that are taught to these students are taught in the mode of instruction in English. When students are communicating with patients in a different language from English, they find it very difficult to translate some of these terms to them. Students feel that in a setting such as Qatar, education in communicating effectively in different languages should be present, and this could take the form of an elective course where terminologies are taught in the different languages that are heavily present in Qatar. Thanks and gig 'em.